Well, thank you, and good morning, everyone. I'm thrilled to be back in Newark with all of you to highlight the challenges and opportunities that we have to help close the gap in maternal health care and to hear more about the work that we must do in order to succeed. And today, as community coming together, we are addressing the racial and ethnic disparities that continue to take too many lives too soon, that irreparably affect families throughout the state of New Jersey. And let me start off by thanking Mayor Baraja for having the leadership, the vision of putting this conference together. He is at the cutting edge of one of the nation's leading mayors on so many issues that affect not just the people of Newark, but the people of our state and our country. So, Mayor, thank you very much for your tremendous work, for your leadership in gathering a conference of hospital administrators, expectant mothers, community stakeholders from Newark and across New Jersey and across the nation. I appreciate Councilman Crump is here, Congressman Menendez is here, and others. And I also want to acknowledge the incredible work of Black and Latina legislators here in New Jersey who have been sounding the alarm and presenting community-based legislation to advance the cause. To the extent that we have made progress, we deserve to recognize them in that progress. When we as elected officials hear directly from our constituents, the very people we represent, it guarantees that the work that we do in Washington reflects your concerns and addresses the issues that you face every day. Just yesterday, as I was voting in Washington, I was looking at the front page of the Washington Post. It read, "Expecting new life, but fearing death." Expecting new life, but fearing death. It was a personal look at why so many Black and brown mothers face the challenges of pregnancy, how what should be one of the happiest times in their lives is instead filled with fear and anxiety about the frightening reality for far too many of them, that being Black and pregnant can be a death sentence in America and in New Jersey, where our maternal mortality rate is one of the highest in the country. Currently, New Jersey is ranked 29th in the nation for maternal deaths with a Black mother in New Jersey, being 7 times more likely to die from pregnancy or childbirth complications than a white mother, according to statistics from the New Jersey Department of Health. The state also reports that a Black baby is nearly 3 times more likely than a white baby to die before his or her first birthday. And for Hispanic mothers, the rate is 3.5 times compared with white mothers, and for Hispanic babies, the rate is 1.5 times. As the Washington Post article pointed out, Black women face substantially higher rates than their white, Latina, and Asian counterparts of fatal cardiovascular issues such as blood clots, hemorrhages, high blood pressure during and after pregnancy. There exists an enormous gulf between white communities and Black communities, rich and poor areas, which makes the maternal health crisis in New Jersey an access problem, an affordability problem, and most importantly, an equity problem. In the fight to decrease maternal mortality and disparities in outcomes, one initiative is underway, something I've joined with. Senator Booker has something called the Black Maternal Health Mommy Bus Act, which I'm proud to co-sponsor, which includes one of my top legislative priorities, the Tech to Save Moms Act. Comprehensive legislation like this, which includes 13 individual bills, when we put them together we call it an omnibus, will help address this crisis through critical investments that comprehensively address every driver of maternal mortality, morbidity, and disparities. The goal is to improve health outcomes for all mothers, regardless of their race or socioeconomic standing, to ensure they return home safely to their families, that they can lead healthy, fulfilling lives as mothers. That's why earlier this year, after hearing over and over again from constituents here in Newark, in Trenton, in Jersey City, I co-sponsored the Senator Warnock's bill from Georgia, the reintroduction of the Kira Johnson Act, legislation to provide a 5-year, $50 million grant program to support community-based organizations working to improve maternal health outcomes among Black women and other racial and ethnic minorities, and to reduce bias, racism, and discrimination in maternal care settings. In May, I also joined Republican Senator Dan Sullivan of Alaska in authoring the Tech to Save Moms Act, bipartisan legislation to support the use of technology, including telehealth and other digital tools, to help reduce maternal mortality and severe maternal morbidity. The Centers for Medicare and Medicaid Services has affirmed that the Tech to Save Moms Act is critical to addressing the specific challenges patients and providers are facing, especially in underserved and rural communities. And to ensure that pregnant and new moms thrive, I have been one of the biggest champions of the maternal, infant, and early childhood home visiting program known as McVeigh. I was proud to help secure provision in the American Rescue Plan that produced another $150 million in staffing and servicing for McVeigh programs across the country. And we've worked to ensure that the McVeigh program is funded at levels to ensure that all who need the program are being reached. This is a program where professionals go into the home, during pre, post care, and is incredibly important in helping families. So let me close by saying not only would passing the Momnibus and the Tech to Save Moms Act save the lives of thousands of mothers across New Jersey and the country, most of all, it would turn the tide on the inequities and challenges they face today at the hands of our country's health system. There is absolutely no reason why the United States should have one of the highest maternal mortality rates of all of its peer countries. Conversations like this can lead to a real, tangible difference being made in the lives of so many people. As your United States Senator, I am committed to work with you, to listen, and to act so that every pregnancy can be a beautiful story of a new beginning. Thank you so much for having me.